good afternoon, or good evening, and welcome to another HR Today Educational Podcast. I'm Elliot Clark, the CEO of HRO Today. We publish HR Today magazine, and we produce the HR Today forums and educational events held around the world, and we manage the HRO Today Association. Today, we're going to be talking about healthcare services and workforce solutions. Strategy in the healthcare industry has gotten modeled. Some of the workforce service providers in the healthcare industry have found themselves on, frankly, life support since the pandemic. Hiring in the healthcare sector remains robust, but these providers that are now in trouble damaged themselves reputationally during the pandemic and in the immediate aftermath, with predatory practices that really hurt their brands and hurt their customer loyalty. Now, as you, the listener, whether your organization is in the healthcare space or not, this is a valuable discussion about the options that clients have as alternatives to the traditional staffing company model relationships. Many healthcare systems have looked to creating their own talent pools. One of the companies that is thriving in this market environment is HRO Workforce Solutions, which is building out programs that help organizations in healthcare take better and more secure control of their talent supply chain. HRO offers everything from full service MSP up to and including programs and infrastructure to manage your own talent pools. We have their Chief Growth Officer, Trevor Strauss, with us today to talk about this current trend, how it arose, and how they are addressing it with their clients. Now, Trevor Strauss is a veteran of the workforce services industry. Prior to HRO, he was an executive with healthcare workforce service industry leaders such as HWL and AMN Healthcare, holding several executive roles. He joined HRO in, about a year and a half ago because he was intrigued by their novel approach. Trevor, welcome to the podcast. And anything you'd like to add about HRO Workforce Solutions for our audience?
No, well, first off, Elliot, thank you for having me today. It's always my pleasure to talk about this topic. And before I even mention anything about HRO, I appreciate your honest candor is probably the way that I will put it from your opening, in that every industry certainly has, some bad actors and people that maybe leaned in the wrong way, post pandemic or during the pandemic. But I think the reality is what we're seeing within our market in general is that legacy staffing practices are what is really changing. The piece that we're noting today is that clients have a desire to do things differently than they did before the pandemic. The days of clients just creating a partnership with one organization and handing it off and essentially outsourcing every decision is changing. And that's really where HRO comes into play, Elliot. And what has us so excited about the future is that those that have truly hurt their brands or were involved in truly negative practices have really worked themselves out of the business. And what we're finding today is that there is a lot of desire by healthcare providers to find partners who want to meet them on their terms and really drive that solution strategy. So again, that's where HRO fits in. As you mentioned, we work the entire continuum of labor delivery, from everything that is internal contingent labor to the external agency management. And we have flavors of programs that we build with clients that are extremely flexible to meet them exactly where they are. So I'm excited about the discussion today. We're excited about the future of healthcare workforce delivery here at HRO Workforce Solutions, and looking forward to sharing more with the listeners.
Well, I appreciate that, Trevor, and you kind of got a little ahead of me, but I'm going to come back and maybe put you on the spot just a bit.
Okay.
So you and I have spoken about these issues of trust in the space, and God, it was about 4 or 5 years ago during our first event after the pandemic, our people in healthcare, event. I actually called out. I told them they would live to regret the predatory behaviors, and I'm not going to name names, nor should you. But what was happening in the healthcare industry that led the organizations? I mean, we don't have to go into all the gory details, that led to look for alternatives to traditional staffing relationships. And you mentioned some of the new options that you're engaged in. If you could expand on that, that would be really helpful for the audience.
Yeah, I think it's a great question, Elliot. And you're right. There were certainly practices that many would call predatory. And there were, healthcare providers that were testifying before government entities about those practices. And, it goes back to organizations finally realizing whom works for whom. I think what's happened in my 25-year career in healthcare workforce programming and delivery, what I have seen is a shift where, for many years leading up to the pandemic and right after, where healthcare providers themselves knew they needed staff, they desperately needed somebody to help bring that staff to them in every labor category. And I think what happened was the paradigm started to move from whom was actually in control. Elliot. And at the end of the day, it shifted from all of us remembering we work for the healthcare providers at the end of the day, the health systems, the medical groups, the post-acute care providers. But more importantly, we all work for the patients in their communities. Our job is to make sure that the right staff is at the right place at the right time to make sure those patient care needs are met. And I think that what we have seen post-pandemic, to your point, is the providers themselves, the organizations have realized, wait a minute, you all work for me. And that's not a negative realization. It's going back to shifting the paradigm back to where it belongs, which is what does that organization need? Because your hospital, Elliot, versus my hospital have two different sets of needs, even if we're in the same community. So a one size fits all approach to workforce solutions is really what our industry started to grow into. It didn't matter if you were somebody who used 20 people a year or somebody that used 2,000 people a year. The workforce solutioning models really defaulted to a staffing mindset. And Elliot, the big difference with Trio in particular, we don't look at when we use the very common acronym of MSP as a managed staffing program. It's supposed to be a managed service program, right? That's where it was built
Right.
for. That's what it's supposed to be. End of the day, most legacy led solutions have become a staffing program. So, what they do is they manage staff. They end up managing the agencies and helping coordinate and providing one level of service that, while helpful, has become a bit more outdated. So, where Trio is leaning into your points around internal talent pools, better managing of the labor, and better control of that labor is that entire continuum. When we meet an organization, Elliot, our first step is truly understanding where they are in that journey. Do they have a partner who has been there for 5 or 10 years, who has done it the same way in that entire window of time, and they have achieved some results, but they're looking for that next level optimization, and that might be using something like we have built in our internal resource management tools. That program is very innovative because we can help the health system pull different levers than a legacy program might. Is it an organization that's never had a program in place? Do they need somebody to teach them how to engage with agencies, how to engage with their internal flex pool staff, how to manage the whole process? That's a different level of dialogue. And then there's the other level, which is someone who has a lot of experience, has built more internal controls, and has made themselves get to a point where they truly need a tech and reporting optimization partner, not a delivery partner. So we look at it from a very holistic level. And I know I keep using that word in our chat here, but that's what's most important to us. Let's look at it from the top. Let's understand the entire picture and figure out where can we become a connective tissue to drive the results that organization is looking for.
So in that vein, can you give me an example? Because, my next question was about some of the options, but we're already having that conversation and what's out there.
Sure.
So you're doing things like creating talent pools, creating flexible solutions. Give me some sense of how some of those are constructed. And one of the other things about Trio that's unusual is, you're doing programs across the entire workforce where, most of your competitors are in nursing and some of the other allied health professions. You also have the ability to do it with the locum tenens, physician models as well. So you give some examples about how those programs are working and the options that your clients are buying from Trio, because you're kind of, breaking out of the traditional mold in a very real sense.
No, and I appreciate that question, Elliot. And I like what you're saying about breaking out of the mold. The way that we refer to it here is it's the evolution and maturation of the business. So the business model itself of what Workforce Solutions is changing. So our clients, Elliot, when they come to us, a lot of times they have in their mind an idea of what they think they need. We love pressure testing the ideas of, listen, that is the basics of what you can accomplish. You believe you just need somebody to manage your agencies to make your life easier. But to your point about the talent pools and the new ways to envision the workforce, that's what we focus on with those clients. So let me give you kind of a breakdown of the options that we bring to partners. We have the what would be the considered historical model of an MSP, again, in our minds, not managed staffing, but managed service program that we run everything from rec to check inside of the platform. We have an advisory services team that's running all the day-to-day management and really creating a massive uplift for the internal team of our partner to then go out and focus in other areas of work while they know they have us to handle everything day in and day out for their contingent labor. The other level that we have that's a little bit different from that is we have partners that are in what we call, excuse me, our VMS plus model, which is somebody who's a bit more advanced. They have a few team members internally that are able to focus on contingent labor on a day in and day out, but they need some additional support that they either can't afford or don't want to hire for. And then Trio comes in with our advisory services team in a hybrid managed capacity. The next layer that we have is our true tech partners in our VMS offering. And those, again, as I previously mentioned, are very sophisticated buyers who have a team of people internally that run either nursing or physician and provider services, have a central staffing office, have a locum tenens team that they can run that themselves. And then we have our enterprise partners, which is our EWM partners, as we refer to them, that use us more to what you're talking about, Elliot, which is that end-to-end solution to build their talent pools. So we have in that internal resource management that I mentioned a few minutes ago, that module allows us to build many types of programs with those partners. That is retirement pools, seasonal pools, local pools, internal agencies. A lot of things that our clients will do in that area are overlaid with our support to look at how do we increase reliance on those flexible models versus just using an agency first. An easy example of that was an organization yesterday that I spoke with, not a current client. They have a legacy program and they are struggling because they are a well-respected top brand within their market, but they are over relying too much on locum tenens agency usage and they're using them for years upon years. And they're looking for a strategy of how do we convert staff to us, build a pipeline for future recruitment, and have a partner that can come in and help us get there. Their current provider, no fault to them, is owned by a locums agency. The challenge that is now creating for this organization is there's no incentive between the two in a partnership to reduce locums usage. So that conflict of interest starts to go away, especially in those larger enterprise engagements that we partner with. The other key piece, though, that you're touching on, Elliot, is just how the clients can evolve in a workforce model. Our goal here at Trio is to be able to sit with our partners and say, we may have these four key distinct areas that we work with you on, but you genuinely may not be ready to go to a tech only solution today. How can we work with you to build a partnership journey that allows you over the next 2 to 3 years to go from maybe Trio running the program today to create a foundation, understand costs, etc., to get to a point where in 24 or 36 months, you're running it all yourself and we are out of the way and you've become your own delivery center. So I think the exciting part when I hearken back to the first comments I made about being excited about the future, in my career, this is the first time where there's real teeth to organizations getting very, very excited about gaining a new level of empowerment and governance through workforce solutions versus just trying to manage the staff. So I hope that answers your question.
It does, and it's very interesting because I think you touched on a very important aspect of what's going on in the market, right? For most of the mid-sized and large healthcare systems that use MSP providers or locum tenens agencies, it's a lot like buying a 1905 Ford Model T. They have a very customized solution as long as it comes in black. Okay. That's it. They claim to be, highly flexible, but in reality, it is a boxed solution. It's the same every time. So the real challenge, it sounds like that you guys are trying to address is your solutioning with the client in more of a partnership model than just saying, how many nurses do you need and when do you need them delivered and for what duration? So how are you approaching that and we're running out of time, Trevor. So how are you approaching that conversation? Because that is unique with locums, with allied health, with nursing, to sit down and say, we're going to solution this with you. That maybe your ultimate goals is to have your internal talent pool. We're going to move you along that process. So give us just a quick insight into how you conduct those conversations, because most of the other folks are not conversing, they're presenting.
I think that's a really great call out about conversing versus presenting. For us, it's all about solutioning. And if you really think back to the example you just used, you think about the Model T, Model A kind of analogy. One of the huge challenges with that car was people breaking their arms with the crank start. And what we try to solve here at Trio is never get to a position where you inadvertently do more damage than you do help in the program delivery. So for us, it is a heavy focus on we know it's a noisy environment. And when we go into a healthcare organization for the first time and speak to them, they've typically heard about it, had experience with it, or have some working knowledge. As you mentioned, the nursing and allied space is one that workforce solutions are extremely common. Depending which report you read, 85% of more organizations use either an MSP or some sort of a vendor management platform to run nurse and allied travel staff. When we think about that discussion, to cut through the noise there, it is much more about, Elliot, the education of what is the struggle today. Because if they're filling 99% of your jobs, you're happy with the rates, and you don't feel your usage is too high, there's probably no value that we can bring to bear in a partnership unless you are wholly committed to reducing that usage, unburdening yourself of agency engagement by building a true internal talent pool that is not simply a group of PRNs that you're going to float in and out whenever you can. That group, that discussion tends to be extremely strategic from day one. We need to sit down, understand what Elliot is going through today, and map out some options on how we believe we can help. And we do that all day, every day, of course, on that side. The other side of the aisle that you've mentioned on this chat is then the physician and provider side with locum tenens, which is still playing a bit of what I will affectionately call catch up to the rest of the workforce industry because it's not a negative, but that space has been dominated for decades with agency to client relationships. Clients have realized that it's becoming more cumbersome. So, in that space, when we go in, there is both an education of how a tech and reporting stack is going to help get clear line of sight, but then it comes down to the noise of there are so many legacy minded people that have moved into that space and are trying to build agency led, whether they call themselves vendor neutral or not, they are true locum tenens staffing solutions. They serve a great purpose. Trio does not serve that purpose. our focus there is we are now in a position where we understand your spend. We understand which agencies you use. We understand how we can pull some additional levers in conversion strategies to an internal agency or a float pool or, local kind of staffing solutions in the locum space. So that side, Elliot, tends to be more about the rationalization of where they are today and the journey we can take them on. While both sound similar, because we're cutting through the noise on both sides of the aisle for workforce solutions, there are quite nuanced aspects to each piece of it. And so, here as well, because you mentioned we service all labor categories, including non clinical, even though our focus today is clinical chat. The reality is, our teams are built in a grow small to grow big mindset. We have experts on both sides of the aisle that partner with our clients. So if Elliot, you only need a solution that is going to be focused on nursing and allied travel spend, we have experts who have been doing it for 20 plus years to work with you to design your solution. If you only need the physician and provider locum tenens side, I have people with 20 plus years of locum tenens delivery experience to manage that and help guide you. And if you are like our enterprise partners who want to create that single system of intelligence, we have the resources to not only bring subject matter experts together, but we have the executive resources that have built these programs for 30 plus years to be able to bring that insight. So that's really how we try to bring all pieces of the puzzle together at the end of the day.
That's awesome. Trevor, we're out of time, but this has been fascinating. We're going to have to continue this conversation again. Let's talk about how you're kind of disrupting the market. Well, thank you so much for taking part in the podcast. That is Trevor Strauss, Chief Growth Officer, Trio Workforce Solutions. They are disrupting. We talk about companies disrupting. They are disrupting in the healthcare workforce services space. And that's 17% of the North American economy. So significant needs and significant challenges. I hope you all have enjoyed this podcast. I'm Elliot Clark. I'm the CEO of HRO Today, and we will look forward to having you join us on our next HRO Today educational podcast. Thank you.